Being a paramedic, you have a chance to get out there in the community and save people.
Open your eyes.
Where's Mum?
They're in their darkest hour and they just hand you all their trust and say, here, you help us.
Our priority is just to make sure that you're okay.
I really enjoy going to someone and turning that frown upside down.
Give me a big smile.
We've got you.
Delivering a patient to hospital in a better state than what they were in is phenomenal.
He'll be all right.
Mum, I love you.
They're like angels.
That's it. Stop CPR. He's got a pulse.
Being a paramedic has taught me life is precious and you shouldn't take a second for granted.
On this episode of Paramedics...
Have you got any pain anywhere?
Big concerns for Nathan and Jodie's daredevil dirt biker.
Can you wriggle your toes for me?
Ow!
Where does that hurt?
You move my leg.
There is potential that the injuries are that bad that he's never going to ride his bike again.
Whoa!
Trauma kit, please. Trauma.
Cam and Al battle to save a young man's life.
Just look at the wound, mate. Just look at the wound.
From the moment that this boy was shot, he needed surgery. So everybody knows that we are on the clock.
I want to get him in the truck.
Oh, wow.
And some sage advice for Nicola.
Well, you can't retire.
Absolutely not.
You remember when you're 92.
Emergency services? Okay, tell me exactly what happened.
Weekends are a busy time for emergency services call takers. This one from a motocross event organiser.
We have a young man that's come off his bike, off a jump.
Okay, and was that a motorcycle or a push bike?
Yeah, a dirt bike, yes, motorbike.
Are there any obvious injuries?
He has been knocked out 100% because he just doesn't know where he is. He's panicking a little bit.
Micah 30 received. We're about 14 Ks from the job.
As Micah paramedics Jodie and Nathan start heading towards the motocross track, more information is coming through.
14-year-old young fella landed on his back and he's dropped from about 5 metres. That's a fair
Fair for a 14-year-old, yeah.
we just hope that he's wearing his protective gear.
Yeah, absolutely. First off, his head is obviously a significant concern for us. And then his neck, as to whether he may have a spinal injury, he may have broken ribs, or even possibly popped one of his lungs. And also a pelvic fracture is an extremely bad injury for any patient to suffer. So there's many concerns running through our minds as to this patient and what state he may be in.
Another crew has now arrived on scene and is radioing through with an update on the teenager's condition.
Currently complaining of lower back pain and neck pain. Got a blood pressure of 90 on 50. Tachy at 130.
Micah 30 received. Thanks, guys. We're about 6.5 Ks away.
His heart rate's running a little bit high at the moment
high.
at 130.
Yeah.
Even if he is in pain, that's a little bit concerning, isn't it?
Yeah. There is potential that the injuries are that bad that he's never going to ride his bike again. That's of grave concern.
Do you reckon you can do me a favour? Clean your glasses? Yeah. We got anything to clean them with?
No, just your jumper will be fine.
There we go.
Oh.
A long-lasting work relationship like Risky and Nicola's is all about helping each other with the little things.
Mate, what have you been doing to these things? Could you even see that last job?
It's really great in this job when you can work with someone who you can have a laugh with and get along with really well. It makes coming to work so much easier.
How's that?
Thank you.
Oh, yeah, I can see it on the other one now.
Yeah. Oh, that's great.
RC 139.
Thanks, RC 139.
Responding to a patient what's been queried as stroke. It's a code 2 at this stage, thanks.
Roger, code 2. So, Risky, we're off to a 92-year-old female, vomiting last night and feeling unwell this morning, unsteady on feet and blurred vision. Query had a stroke, no limb weakness or facial droop, speaking clearly, lives at home alone.
So strokes are normally classified as a Code 1 response, lights and sirens. This has been classified as a Code 2 response, and that's because her symptoms started over 10 hours ago.
It says that she's had a stroke in the past, so I think that's why she's like thinking.
Oh, it's the same as the last one.
Possibly.
Those symptoms are a stroke. Like, I mean, blurred vision can be.
Yeah.
Unsteady gait absolutely can be. These symptoms may indicate a stroke, but we can't go in just assuming it is a stroke. We need to explore the fact that it might be other things such as infection, dehydration, a urinary infection, or even a bowel infection.
150 metres away.
Geez, the ambulance is off road today.
On the outskirts of Melbourne, Jody and Nathan have arrived at a motocross track where a 14-year-old has had a serious accident.
Wow, this is a proper setup, isn't it?
Yeah.
The teenager's throttle jammed as he was going over a dirt jump, causing him to fall 5 metres to the ground, knocking him out.
I'll just grab the med bag for now, Jody.
It's a major concern that someone's lost consciousness, particularly coming off a motocross bike. So having had a significant fall with a head strike, they may have an underlying head injury that's life-altering.
G'day, guys. My name's Nathan. I've got Jody here.
40k's gone up this hill. It's probably landed about 15 foot. We just managed a little bit with methoxy. Got IV access in. He's had 8 of them down.
Okay, all right. G'day, Chris. My name's Nathan. How you going?
Hey, Nathan.
Have you got any pain anywhere?
Yeah, in my arse, bro.
In your bum? Right in your bum?
He landed on it.
So landed on his coccyx and then bang backwards?
Up in his head. The bike flipped through the air and he landed on his ass.
All right. Can I get you just to get a fluid bag organised? Can you wriggle your toes for me?
Yeah, I'm doing it right now.
Yeah, good. Other leg? Any numbness or tingling there?
Nah, mate.
Okay. We're going to get your boots off as well.
Ow!
Where does that hurt?
Like when you move my leg.
The fact that he's able to move his arms and legs indicate that his nervous system is working, but lower back pain might indicate that he's got some spinal injuries, some abdominal injuries or pelvic injuries, which are all life-threatening for him.
We're going to take that helmet.
Oh, are you?
Yeah, it's got a nice big split there, which is not easy to do.
You know, when we go to motorbike accidents, we look at whether they're wearing a helmet and then have a look at the helmet itself.
Not normal.
No, absolutely not.
Chris has had a big crack right on the fold of the fiberglass, which indicates to us there's been a big hit, which increases our suspicion of a head injury.
Chris? Chris, what's the matter?
I don't know.
Hey, we're going to look after you, OK? Yeah. Everything's going to be perfectly fine.
Yeah.
All right?
I think, especially young kids, you have to reassure them that it is going to be OK and that they are in good hands.
Where's Mum? I want to see my mum.
His mum is just about here. So.
OK.
Now, he is still just 14 years of age, and if there's potential that he couldn't ride again, it would make you upset. And he's obviously scared as well as to what's going to happen to him.
On go, ready, set, go. Nice and slow.
Mum!
Mum's here, so. All right, perfect. There we are.
No one likes to see young kids hurt, but given how high he was off the jump, that's a significant fall. So, you know, we've got this real anticipation that his injuries could be really serious.
On the right.
Yeah.
We're going into houses today.
In Melbourne's eastern suburbs, Risky and Nicola have just arrived at the home of a 92-year-old lady who's having a suspected stroke.
Hello. Hi there.
I'm Steve. Eileen's mother-in-law.
I'm Nicola. This is Michelle. Hello. Eileen, was it?
Yes.
Hello, Eileen.
What's happened today?
I got violently ill last night.
Yep.
And I've done that each time I've had to stop.
Okay. Violently ill in terms of vomiting?
Oh, yes.
Okay.
Eileen is 92 years old. She could have a number of different medical issues and we need to be able to rule them all out.
I'm fairly vacant now.
Okay.
And when I'm walking, I'm unsteady.
Okay. All right.
But I'm still mad.
Can I slip this arm out just to get your blood pressure? Can we... Yeah, this way.
What other symptoms did you have with your previous strokes?
Similar.
So vomiting?
Yes.
Loss of balance?
Yes.
Yeah. Okay. How many strokes have you had in the past?
About 4.
About 4.
When Eileen tells us that she's had 4 strokes in the past with similar symptoms, I'm definitely concerned.
Reach up and pop your arms up and hold them there for 10 seconds. So 10, 9...
Cognitive tests will help determine if Eileen has had a stroke.
2, 1. Very good. Give my hands a squeeze. Good. Pull me towards you and push away. Very good. Okay.
We do a stroke assessment and Eileen seems to be okay, but that doesn't completely rule out a stroke for her.
You feeling dizzy?
Yeah.
Yeah, okay. That's okay. No worries. Good job.
Before we move Eileen to the ambulance, I want to do a 12-lead ECG just to rule out any cardiac causes for her dizziness.
Just sit nice and still for me. It's irregular and it looks like an AF. I'll just print it out though.
Yep. You don't have any pain at the moment?
No.
No. Do you have an irregular heartbeat? Do you know? No. You ever heard of anything called atrial fibrillation?
A bit of heart problem.
Okay.
So the ECG shows that Eileen is in an irregular heart rhythm called atrial fibrillation, which is concerning because it can put you in increased risk of blood clots, which can cause a stroke.
So this is what I think. We run you up to the Austin and get them to check you over up there, okay?
Okay.
All right.
Oh, my arms pumping up.
That's okay, that's okay. We're just taking the blood
Just going to take a blood pressure.
It's fine.
Across town, Nathan and Jody are assessing the full list of possible injuries their 14-year-old patient Chris might have after falling 5 metres from his motocross bike. Mum Natalie will join him for a trip to hospital.
So we've given him some pain relief, the green whistle. I've also given him some fentanyl, which is like morphine.
We're going over the top, and we're going to pull these down.
I think we shimmy them down.
Yeah. Are you happy to do that now?
Yeah.
Pelvic injuries result in lots of bleeding.
Oh.
So we want to make sure that we bind his pelvis because that can potentially be a life-threatening injury.
Where does that hurt, mate?
Just like in the arse bone.
Just in your bum.
In your bum bone.
Still.
I'm sorry, Mum.
Luckily for Chris, he was wearing the protective gear, but that doesn't mean that he's not going to sustain some injuries. So we need to be really diligent and keep a close eye on all his body systems just to make sure some injuries don't show themselves a little bit later.
Can you tell me what day of the week it is today?
Sunday.
Sunday? What month are we in?
Don't answer for me. I got this one, I promise. January. We're in March.
We are in March?
Yeah.
Nice. I think we're almost ready.
Thanks, ambulance lady.
Yep, no problems. No worries at all. I'm going to drive you.
Chris has been travelling at 40 kilometres an hour and he's landed on dirt that's essentially like concrete. He may have a head injury. He may have a fracture in his back. He may have a fracture in his pelvis and he may have internal bleeding.
It's just a bit bumpy on the way out.
No worries.
Chris has suffered a major trauma and we need to get him to definitive care as quickly as we can.
I've left the track many a times in these.
I can imagine. Kids and their bikes, eh?
Yeah.
Do you race competitively?
Yeah, won the Vicks last
Won the
year.
Vicks. So you're a pretty good rider.
Yeah, good.
Good.
Chris is not the only son Natalie is worrying about. Her eldest son came off earlier at another motocross track.
He's had a big crash.
Is he okay?
Yeah, his back's pretty sore though.
Was it bigger than mine?
I'm not sure, love. I didn't see yours and I haven't seen his.
Mine was massive.
Yeah, we're here now. So you're going to be in really good care.
Thanks, Rosie.
No worries.
At the Royal Children's, Chris will get fully assessed and then sent off, I think, for some imaging. I think the worst case scenario is maybe some spinal fractures and a pelvic fracture, which could result in a significant stay in hospital.
Good job.
Made it. Made it.
Now, do you have to put the seatbelt on?
I better get out of the way.
Risky and Nicola are helping Eileen get to the ambulance.
It's like your own personal roller coaster ride or something, isn't it?
The 92-year-old has previously had 4 strokes, and the worry is she could be having another one today.
It's so slow it drives you mad. If it went any slower, it would stop.
Eileen has a really good sense of humour, which can make our job a little bit easier. She's lucky to be doing so well, but we definitely need to get her to hospital to be assessed.
Austin, was it?
Oh, yeah, you've been there for strokes in the past, haven't you? Yeah, we'll go to Austin. Good to go. Thank you. So blood pressure's 150, 2 on 70H, still in the AF of 80, starting at 96%. Is that a bit more comfortable?
That's good.
Yeah.
Thank you.
No worries. And still no pain anywhere?
Strangeness around the head.
Feeling strange, yeah. Have you ever had a heart attack before?
No, not a heart attack, but I still do a lot.
Do you? What sorts of things do you do?
Well, I go dancing.
Oh, do you? What kind of dancing?
Irish dancing.
Oh, wow.
Well, you can't retire, can you?
Absolutely not. No way.
You remember when you died, Gigi?
Oh, I'll remember.
I'm super impressed with their ability that she's still going out and having a good time at her age.
We'll just pop this one on. Keep you safe. Just about to pull into the hospital, okay? All right.
Thank you for your help.
You're welcome. Thank you for your sense of humour.
I hope the next person is sane.
Full house. Nowhere to park.
Couple of bumps again.
Eileen should be assessed by the doctors who'll do a more detailed stroke assessment. They'll do a scan of her brain and see if there's any evidence of stroke. And if not, they'll work out what else it could be that's causing these symptoms.
On the move.
I really hope this isn't something serious for Eileen and she can go on and do that Irish jig.
Yeah. Hold on.
Micah 30.
Micah paramedics Cam and Al have just been dispatched to a frightening emergency.
Is this real or not?
We get dispatched to a lot of things like shootings, and they're not always real. Sometimes people have got misinformation or they heard a bang or whatever.
Clearly.
A second crew have also been dispatched and are providing crucial information to all units heading to the job.
So they're in front of us.
While we're on our way to this job, we start hearing a few reports, and I start thinking this could be real. We could be on here.
Okay, the request is urgently. We need a whole house to return the way.
All right.
Trauma kit, please. Trauma.
Trauma kit.
What's his name? Just look at the wound, mate. Give us a look at the wound.
That's an open wound.
Yep.
When I look at the hole in his chest, I think it's just huge. It's horrific. And there's no large amounts of blood volume. In a way, that scares me more. The fact that maybe he hasn't got any blood left.
Get a BVN for us. Airway set up.
Right now, I've got a patient with a big hole in his chest that's unconscious, and it looks like he's breathing, but it's not normal breathing.
Right. He's got agonal rests.
Yep. Agonal rests, so the body's still trying to breathe when it's absolutely fighting for life. So my priorities are to control breathing, to control the hemorrhage, and to maintain blood pressure.
Can I have quick clot? Grab me a heap of quick clot. Thank you.
From the moment that this boy was shot, he needed surgery. So everybody knows that we are on the clock.
I want to get him in the truck.
Emergency services. Okay, so tell me exactly what's happened.
A worried motorist is seeking urgent help after witnessing a shocking crash.
It looks like 2 cars have been involved in a car accident.
Okay, how many people are hurt?
2. It's a major accident.
139 for 2 car MBA. Hurry up, please.
RC 139, receive cover.
Mike and Eamon are now on their way, lights and sirens.
We are going to one female, broken wrist possibly, and she's bitten her lip quite badly. I think police are on scene. Have you ever been in a car crash?
Not since I was a little kid. It's got to be pretty scary, though.
Oh, yeah, I got rear-ended at a set of traffic lights, but gee, it made a bang.
With car accidents, there's a lot of different variables. So even a low-speed impact can cause serious injuries. Because it's not just about how fast you're going, it's about where the impact happens, how your body is thrown around the car, and most importantly, are you wearing a seatbelt?
Oh, great vision by that person.
People are getting a bit better.
Bus stop, 9 out of 10.
Fortunately, tonight the public are doing a fantastic job and moving left. It allows us to get to our patients quicker.
Oh, no. Plenty of people stopped up here.
When we arrive, things don't look good. The cars are pretty smashed up, the airbags have deployed, and that tells us that there's been a significant impact.
Both drivers have managed to get themselves out of their cars. One of them appears unharmed. The other, a 23-year-old, needs to be examined.
What's your name?
Eilish.
Did you lose consciousness?
No.
I'll have a quick look at you, all right? Obviously, you've got some pain in that right hand. Have you got any pain in your neck or anywhere else?
No, I don't think so.
I'm the mum.
Hey, Mum, what's your name?
Sharon.
Sharon, come on up.
Eilish's mum and dad raced to the scene after getting a call from a lady who witnessed the crash.
She said your daughter's had an accident. Is she okay?
Not the phone call you want to get, is it?
No, well, I'd rather have that one than another one.
Of course.
I'm just going to feel down your back. Any pain in there?
No.
Where are you off to tonight, Eilish?
What are you training?
Oh, yep, that's why you got shorts on such a cold night. So, you're holding that arm. Is it a bit painful?
Yeah, the hand is, yeah.
All right. You probably haven't had a look in the mirror, but your face is pretty swollen too.
Poor Eilish, she's in a bit of strife. She's got this really sore arm, a quite swollen face and cut lip. I can tell there's a lot of soft tissue involvement, but what I'm more worried about are the underlying bones like her eye socket, her jaw and her teeth. So it's pretty scary stuff. We'll look after you, okay?
I need some light. You got light, mate, on his chest?
Cam and Al are desperately trying to save Winnis. The 20-year-old was shot in the chest at close range and is now fighting for his life.
Just marking him up here. Second intercostal space.
Yep.
Okay. Between nipple and there. All right.
Al is inserting a decompression needle to try and inflate Winnis's lungs, while Cam introduces a tube into his mouth to help him breathe.
Okay, bag valve mask.
All right.
Yep.
You happy?
Yep.
People can die from what we call a tension pneumothorax or a collapsed lung that's under pressure. So those needles, they're designed to release that pressure and inflate a bit of that lung to take the pressure off the heart and also the major vessels, so you get blood returning back to the heart.
He has got an output. I can feel an output.
Heart rate's 104. Can you just do me a favour? Can you trim off the rest of that shirt for me, please? Can I have some trauma dressings for the back?
The victim's girlfriend, Marina, has just been told about the shooting.
I was actually going to meet him, so I was driving. So I told the person next to me to answer the call, and I didn't believe it. I thought the person was joking. It was a shock for me because it's not something that you would ever think that you'd hear.
Hey, he's spont venting, right? So we'll need to do his chest properly. You'll need to set up to the finger, right? And I'll sort out the rest.
Me and Winnis have been together for 6 years. He's like my first ever serious boyfriend, the first guy I ever really told my mum about. He is very, very loving and patient and very kind. He has a presence that, you know, it's just contagious.
I need the torch on that side, right? Okay, we're gonna have to roll him and look at the back. Bringing him over. Tell me what's there. Go. Tell me what's there. No exit wound. No exit. Back. Back.
I can't see an exit wound, so there's probably a large bullet or a fair amount of pellets that have stuck in his body. They could be stuck in a major artery. They could be in his heart. I don't know at this stage.
So I want the board under him now. Yep, slide that under here.
So we need to get what we need done quickly and get to hospital even quicker.
1, 2, 3, up.
You were wearing a seatbelt, I'm guessing?
Yeah.
Yeah. And you seem to remember everything happening?
23-year-old Eilish never made it to footy training after colliding with another car. Mike and Eamon are assessing her injuries in the back of the ambulance with worried mum and dad watching on.
All right, I'll have a look at the cars, mate. While Mike does his assessment, it's important that I just have a look at the vehicles and the scene to understand the forces that were generated in this accident. I'm looking for things like cabin intrusion. Has the vehicle actually come into where Eilish was sitting and caused injuries there? Is there starring on the windscreen, which tells me she may have hit her head there? Both airbags deployed, no cabin intrusion, no starring on the windscreen. While Eilish has been lucky, it appears that she hasn't escaped this one unscathed.
Can you tell me what year it is today, Eilish?
2022.
Excellent. All right, just going to shine a little light in your eyes. You just look at me. Beautiful. Headache or anything like that? No. All right. Can you bite down? Have you got any loose teeth or anything like that?
No, thank God.
No. All right. Just going to have a quick feel of the jaw there. Yeah, and that side. This side might be a bit tender in there. All right. Okay, so I don't reckon you've done your cheekbone or your eye socket. All bones feel intact, which is good. Any pain up in the arm there or in the elbow? No, a little bit swollen in the hand there. I'm just going to feel your wrist. That's all right. And in the thumb's all right. Okay. So it's a bit painful in there?
Yeah.
All right. How is your pain at the minute? 0's no pain, 10's the worst ever, and you're not being a tough footy player?
It's probably a 4.
A 4, okay. Pop them in, that's 2 normal Panadol.
It's important to get on top of Eilish's pain now, because although it's only quite mild, once that initial shock and adrenaline rush wears off, she could start to feel very sore.
Numbers-wise, we're all looking well here, mate. GCS is 15, blood pressure's perfect.
Yeah.
So I think your injury to your hand's almost certainly from the airbag, so that'll need an X-ray.
After assessing Eilish, I'm really comfortable she doesn't require an emergency ambulance, but she does need to head down to the hospital with her family to get checked out.
Things that we would be worried about between now and you arriving at hospital are if Eilish falls asleep and can't be woken up, if you start vomiting really heavily, if she has a seizure, any really seriously concerning things like that, then you can just pull over and give ambulance a call. But I don't foresee any of that happening, because otherwise I would take you.
Yeah, no, that sounds good.
Footy training is definitely off the cards tonight. Hopefully when she gets down to the hospital, they don't find any fractures and she can get back to doing what she loves. But if she has broken her hand, that could have huge long-term consequences. So hopefully she's okay.
Fortunately, the airbags have all gone off. She had her seatbelt on.
Yeah, I mean, lucky. That's it. That's how I would describe her.
Oh, yeah. Yeah, very fortunate.
Watch your back, watch your back.
Okay.
You need to do it here.
Yep, okay. Here it is.
20-year-old Winners has a bullet lodged deep in his body after being shot in the chest at close range.
Just move that door. I need that door wider.
He stands a better chance of making it to hospital alive if Mike Orell performs a finger thoracostomy before they head off.
Hey, Nanto, can you undo
I need that light on.
The light on, please. Rear light.
Hold his arm out here. I've got a sharp here.
The procedure that Al is going to do, cutting a hole in the side of somebody's chest and opening it up and putting your finger in there to be able to let air or blood leak out, it's a big deal. And it could be the difference between getting to hospital and not.
Well, I'm in.
At the same time, Cam has intubated Winners to protect his airway and assist his breathing.
We've got blood pressure 79/55, heart rate's 147. We'll see if we've got internal.
Yep.
Good waveform.
I can feel lung, so it suggests that that side that I've made the incision hasn't actually collapsed.
We got to go, Al.
Yeah, we got to go, I know. We're done. Let's go.
Go.
Have we got access? No?
Nah, it's an IO's ready for you, Al.
Okay.
Across town, Winners' older brother Baba has also just heard the news and is racing to the hospital to be by his side.
My phone rang, my sister rang me, and she told me when he's got shot and he's on the way to the hospital. I didn't know what to do.
Can someone just give details?
Yeah, okay.
Winnes and Baba came to Australia as children, their family leaving South Sudan for a chance at a better, more peaceful life.
I remember when he was born, I was just outside in the room and heard him crying when he was born. I can still hear that. And he's a great young man.
Just turning slowly and
Yeah, you're right.
At this stage, we've reassessed him and he's become even more unwell. His oxygen levels are barely reading, which tells me that he's barely got a blood pressure, if at all. He needs a trauma surgical team that specialise in this kind of wound and injury. I need to get him to hospital quickly.
$99 received, thank you.
Micah paramedic Andrew is working as a single responder on this busy night in Melbourne. He's on his way to help an elderly lady who could be in real strife.
Just been dispatched to an 82-year-old lady who is complaining of shortness of breath, being weak and is apparently pale, so that's really concerning.
From the information I've been given, this could be anything, but the big ones that I'm concerned about are heart attack, heart failure, asthma or infection. The other big concern is the patient's age, as an older person can deteriorate quickly.
Hello, ambulance.
Hello.
How are you, mate?
Good, thanks. Come in.
No worries. What's your name?
Ian.
Ian. What's your mum's name, mate?
Barbara.
What's going on, Barbara? Let me check your pulse, will you?
Pulmonary heart and lung failure.
Right.
I've had shortness of breath for a long time.
Right.
Tonight I went into the laundry.
And you felt?
I didn't feel
acutely breathless.
I helped her from that chair to this chair.
Good man.
I just kept going dizzier and dizzier,
Sure.
so I called out to Anne.
Her eyes were like a doll, wide open. She's going like this.
Right. Do you have any pain at the moment, Barbara?
No, just
No?
a bit of dizziness.
Dizziness. All right.
Yeah.
All of Barbara's signs tonight are deeply concerning, and it could be caused by something serious such as heart attack or respiratory failure. So right now, I've got to determine if Barbara's presentation tonight is part of her chronic condition, a change in that condition, or if there's something more sinister happening.
Let's look at your blood pressure and your heart rate. Blood pressure's great. Probably better than mine. Right, so I'll do the 12-lead ECG. Just still for a minute, Barbara. Nothing jumping out at me. Have you had a cough at all? Productive cough, nothing? All right. Breathing through your mouth for me. Big breath. No really nasty sounds there, which is good.
After assessing Barbara, I can eliminate any immediate life-threatening conditions such as heart attack or fluid on the lungs. So what I'm left with now is a host of different conditions that could be affecting Barbara and need to be investigated in hospital. And that's what I'm recommending tonight.
I know it's not what you want to do, but we get you checked out. If we were to leave you here and then something deteriorated, we'd, never forgive ourselves.
A backup crew have now arrived to take the 82-year-old to a nearby emergency department.
Okay, can I give you a hand, Barb?
So Barbara will head off to hospital and hopefully they can investigate the cause of the breathlessness and dizzy period.
I gotcha. There you go.
Hopefully it's nothing too sinister and she can get some much-needed answers.
Yeah, it's Micah 30. We're coming to you on Signal 1. We've got a 20-year-old male that has a central gunshot wound to his chest.
Micah paramedics Cam, Al and Bruce are racing to hospital with shooting victim Winnes. He's in a critical condition with a bullet lodged inside him.
On the way to hospital, Al's giving him small boluses of fluid. He's got such a low blood pressure, if any at all, that we're just trying to prop it up enough just to get him to hospital.
How old's this kid, mate?
Well, I call him 20, but he could be anywhere, I suppose, from 16 to...
Who shoots a 20-year-old, mate? Seriously?
Winnes's mum is also struggling to comprehend the shocking news.
We're running away from my country because of the gun. My son, he loves everyone. He's very friendly. He's a good boy. He's listening to me. And he's very hard worker. When he finished high school, he told me, "Mom, don't work again. I will look after you."
Yeah, he's an agonal rhythm now.
Yeah. Well, is it still around the 30 mark, or...?
Yeah.
Yeah.
40.
There's nothing more we can do now. It is really up to what's going to happen in the emergency department.
Trauma teams are standing by to help Winnes, but everything rests on where the bullet is lodged and how much damage has been done.
Go.
You know, as you walk into an emergency, there's part of you that knows he's deteriorated, but you're still holding on to the thought that they'll do something miraculous and turn him round.
Mum, I want to see my mum.
Nathan and Jodie's young patient Chris fell 5 metres when he throttle jammed going over a motocross jump.
Nice and slow.
Mum!
Although the 14-year-old had a lot of lower back pain, at hospital he was cleared of head and spinal injuries and sent home to rest his bruised coccyx. Chris hopes to be back out, hitting the track soon.
Do you have any pain at the moment, Barbara?
No, just
No?
a bit of dizziness.
Dizziness. Barbara's son called emergency services when his 82-year-old mum was complaining of chest pain and feeling dizzy. After a number of tests at hospital, she was diagnosed with pulmonary hypertension, but is now back home and taking medication which has made her feel much better.
So it's pretty scary stuff. We'll look after you, okay?
23-year-old Eilish was involved in a car crash on her way to footy training. She escaped life-threatening injuries, but a trip to the ED was needed for x-rays.
You're holding that arm. Is it a bit painful?
Yeah, the hand is, yeah.
Once there, doctors confirmed Eilish had a ruptured tendon and 2 fractures in her ring finger and 1 in her hand. She's still wearing a splint and hasn't been able to play football since.
I need some light. You got light, mate, on his chest?
Winnes was fighting for his life after being shot in the chest at close range.
It's marking him up here. Second intercostal space. Yep.
Cam and Al did all they could to get the critically injured 20-year-old to hospital for emergency treatment.
Go.
Winnes's family rushed to the Alfred Hospital to be by his side.
So how's the week been so far?
I don't know. I think I've been trying to distract myself.
Yeah.
Yeah. I'm just taking it easy. I feel like spiritually he's still with me.
Yeah.
5 hours after arriving at the ED, the family were told Winnes had not survived his injuries.
I was shaking and didn't know what to think, didn't know what to say, and just some breaking down moment. There was no words.
I've been in school. This 8 year, 9 year. For the, yeah.
Winnes's mum and dad are also struggling to come to terms with the enormous loss.
I'm sad because he did not have kid. He didn't marry. And I love to have kid. That is so sad for me. We broke 2 family. The girlfriend family, my family too.
I think the hardest part is not what we would have done together, but My pain is for the things that he wasn't able to do. If anything, I know he'd tell me to just keep working hard and to keep smiling and laughing when you can, and just keep being kind and there for people when you can, but also there for yourself when you know you need to be. So it's definitely something that I'll never get over, but what can you do with life, you know? We just have to respond and keep going.
Can I slip this arm out just to get your blood pressure?
92-year-old Eileen thought she was having a stroke, but delayed calling an ambulance for more than 10 hours.
You feeling dizzy?
Yeah.
Yeah, okay.
Fortunately, the diagnosis was a urinary tract infection requiring a 3-day hospital stay. But it wasn't long before Eileen was back doing what she loved.
Keep going, Eileen. Love that swing.
I'm feeling absolutely marvellous. It was a great relief to know that I hadn't had a stroke, because I don't want to be held down. I still want to get up and get out and do all the things that I usually do.
Daughter Julia is not surprised her mum got straight back into her Irish dancing.
When I think about my mother, I couldn't be happier than seeing her doing what she does. She's an inspiration because she just lives every day to the fullest.
Dancing makes a person feel alive. It's fun to go out and have a laugh and just be yourself.